Webinar will be recorded. Also, all opinions offered are the personal opinions of the participants and should not be attributed to their respective organizations. We'll start off our webinar with introductions, followed by the presentation, and then finally our question and answer section. Please be sure to use the chat feature during the question and answer portion. This webinar is being hosted by the Supply Chain Resource Cooperative in the Poole College of Management at NC State University. The Poole College of Management's Supply Chain Resource Cooperative is a unique industry university partnership dedicated to advancing the supply chain industry in the professionalism of its practitioners. The SCRC provides support services and programs to benefit three overlapping constituent groups: supply chain management students, supply chain thought leaders, and corporate partners from diverse businesses and industries to create a full circle of impact, innovation, and real-world solutions. Our presenters today are Dr. Robert Hanfield, who is the Bank of America University Distinguished Professor of Supply Chain Management and the Executive Director of the Supply Chain Management Resource Cooperative at NC State University. Dan Finkenstadt is a major in the United States Air Force. He is an assistant professor at the Graduate School of Defense Management at the Naval Postgraduate School, and he will also be presenting with us today. At this time, I'm going to go ahead and turn it over to Professor Robert Hanfield.
Thank you very much, Troy, and it's a pleasure to be with you all here today. And you know, the thought process for Dan and I in putting together this webinar was we've both been involved extensively with the Joint Acquisition Task Force since early March on the COVID healthcare response, working with FEMA, DHS, the National Stockpile, and a number of other agencies as well, and increasingly have been engaged in discussions around the global supply chain and the vaccine. And you know, the more we started to dig into it, you know, to some extent, the more worried we got. And you know, there's been a lot of assurances from the you know, Operation Warp Speed and a lot of politicians, and if you watch CNN or you know, Fox News, it all seems like it's a no-brainer. It's going to go smoothly, but actually, you know, we do have some concerns around how this is all going to roll out, and we'll share with you some of our insights today. So next slide, please. We'll begin by kind of talking about the nature of globalization that's occurred to supply chains. And you know, we're in a different world today in 2020, 2021 than we were in 2000. And the biggest changes have been the fact that China, as you can see on the right, has really emerged as a central player in global trade. And what has also resulted as part of that is a lot of healthcare institutions have outsourced a lot of the production of their PPE, their healthcare supplies, and a lot of tier 1 and tier 2 and tier 3 supplies to suppliers that are in China, in various parts of Asia. And that has primarily been made on the basis of low cost. What we've seen, and Dan and I have seen this a lot since March, is that these supply chains essentially failed because of the distance, because of the export issues, and the availability of these supplies pose real risks to the United States and in other countries in Europe in terms of supply. So that was sort of setting the stage for where we are with the vaccine, because many components of the vaccine are also likewise subject to these potential exposures in terms of risk. Next slide, please. The impact of this, and this is something I think that most people are starting to understand, and supply chain has really been at a central point, or really has become a much bigger issue in this, is that these large original equipment manufacturers like 3M and others have as many as 5,000 direct suppliers, and each of those suppliers have their own suppliers. So you get these very extended supply chain networks that extend all over the world. And it only takes one incident to really disrupt these operations. And the last point is that many organizations don't even know who is in their supply chain. And we've seen this for N95 masks, for gowns, for gloves, and as well, a lot of the key active pharmaceutical ingredients that are being produced in Asia. So this has resulted in a much more delicate or fragile supply chain as it relates to our healthcare supplies. Next slide, please. So now back to the vaccine. Well, where does this put us in terms of the vaccine? The vaccines, as you know, the Pfizer vaccine was approved by EUA last week. It's being rolled out. There are people probably getting the vaccine at this very moment. And the CDC has advocated that this is really going to be sort of a 3-phase project. And there's a document that came out from the factory to the front lines, which is the Operation Warp Speed strategy for distributing a COVID vaccine. And the only bottleneck they anticipate is they say, well, we think there's going to be, some problems early on in phase 1 during this first phase of, key healthcare workers, long-term care facilities, and so forth. But that this is going to open up, and very soon there's going to be plenty of doses available. The Moderna doses, possibly the J&J and others will start to come forward, and everyone's going to get vaccinated, and COVID will go away, and we can put all this behind us. So that's sort of the happy thing that's going on at the moment regarding this. We do want to point out that as we started to look at this problem, we used a framework called the Supply Chain Operating Reference Model, the SCORE model. And we started to look at, well, what does it actually take to bring that vaccine out to the public? And as we started looking at these different phases of the supply chain, we discovered, there really are some potential hiccups or bottlenecks that can occur. And this plan assumes that everything is going to go smoothly. And we're making a point. There may be some issues here as well. And really, the first issue that came up to us is that the plan doesn't really plan on how to vaccinate the vaccinators, right? It doesn't really plan on how do we deal with vaccinating the people who are administering the vaccine. And this is a key lesson that, I think in the defense sector that you've learned the hard way as well through your experience, Dan. Maybe you can comment on that a little bit.
Yeah, so part of this is starting, Rob. Thanks a lot, and welcome everybody. Thanks for having me. But part of this, when we were looking at it, was at the point of the needle, really, where we were delivering. And I took this as like visually in my mind when I used to work refuelers, which was like at the point of the refueling of an aircraft, right? Like if you only worry about the F-16 that's flying around and don't worry about who's going to refuel the F-16 to do the mission, then you just have a bunch of lawn darts flying around, right? Because they've got one tank of gas and then they're out. And so what we're really concerned about is the entire value chain stemming from the needle all the way back into what gets the vaccine in their hands and all the people along the way who are making critical deliveries and logistical decisions and logistical services that help that vaccine arrive where it needs to be. Because if you don't consider those folks, then right now we're putting essential healthcare workers and the elderly at the front of the line without consideration for the fact that there are people who have to get it to them and have to deliver it to them as the primary, as some people that should probably be in that phase 1 in our mind. And when I look at a lot of the literature that's developed by a lot of really smart people on vaccine delivery, it is very much from a healthcare provider perspective. It is not from a supply chain perspective. And I think if anything, COVID has shown us is that we've got to have a little bit more of that consideration in our planning and our logistical setup. And we've seen that in the government when we're planning for joint deployment operations downrange. We early on, it's probably been 10 years ago now, realized that if we didn't start putting joint source planning as part of how we sort of lay out our procedures for any operation, then and we don't have those supply people at the table and those contract people at the table, we're going to be really hurting when it comes to operational planning. And I'm kind of seeing that now, where there's a lot of those early value chain considerations that weren't, or at least are not demonstrated in the documentation that's been put out.
Great. Next slide, please. So I think a first place to start is the first phase of the supply chain, which is the overall plan. And there is a plan here, and we've got a copy of it, and we've read it. But some of the immediate concerns that come to mind right away are the allocation issues. And I'll give you an example. I spoke with my physician yesterday, and I asked her, well, has this state determined how they're going to allocate these issues? Well, yeah, they have. But how are they going to actually, check up on that? How are they going to determine that? How are they going to validate that you're in that first wave or that second wave or third wave? So those are the kinds of details that are concerning, because there really isn't a good plan around where the vaccine should go, how they will be allocated on the ground at the state level, and the communications between states and the federal government have been spotty at best. Let me put it that way. So again, in the plan says, well, we're going to create these micro plans and we're going to collaborate with the state at each level. That hasn't really been effectively done. Those are nice words, and perhaps they're intended to make you feel comfortable that, oh, they've got it handled. We're not as optimistic about that. The second piece that we think is important from a planning perspective is just tracking and monitoring. There's some wording around pharmacovigilance, tracking the after effects, but there really isn't a digital approach to be able to identify how are people going to be notified of the second dose of the vaccine, how will they know which vaccine to get, and again, people are waving their hands and saying, well, I'm sure they've got it covered. That doesn't cut it. Anyone who's worked in supply chains recognize if you don't have a plan to work, you can't work the plan. So the risks here, of course, are potential shortages, hacking, having people, hopefully get access to the vaccine earlier, even though if they're not in a wave, potentially the lack of coordination that can occur, and there's a lot of security issues around the transfer and especially the transfer points at each point in this vaccine supply chain, because that's where you can get theft, you can get sabotage, you can get counterfeiting, and these are all real concerns. This vaccine has been referred to as liquid gold, right? So anytime you have something that's of high value, there's a potential for some level of nefarious activity to go on. Dan, maybe you want to comment on that as well.
Yeah, so a couple of things, Rob, on this slide that I think are worth noting. So you brought up tracking that second dose of the vaccine. If you look at the systems that the CDC have been working on, I'm hoping they're going to be what they say they are. It sounds like they're trying to track as well as they can at the, to the hospital level, what the vaccines are actually, how they're being distributed and stuff like that. The big hang up I see there is that there is not one overriding vaccine. There's going to be multiple types of vaccines. And basically, once you start a series, you are now wedded to that vaccine series, right? And so how do we track the individuals themselves at the individual level? So I think there's some things we could think about actually putting that power into the hands. I know not everyone in America has a smart device, but a majority of them do, and that could really cut down on the administrative burden of trying to track and trace people if they were actually scanning themselves into a system for the vaccine that they have. The other thing is communicating to people that you may be physically locked down to a geographical area once you start a series, because as states determine the allocation of, let's say you go into Pfizer Series 1, Now, are you able to go get your Series 2 from any Pfizer providing location? Or do you have to stay to your county? Do you have to stay to your state? Do you have to stay to your region? I haven't seen that plan lined out, right? And so, again, if we carry that tracing and tracking data at the hospital level and it's not transparently transferred to the individuals who are going to be responsible for helping manage that, then you're going to end up in some sort of bedlam where everyone's running around trying, because people are going to assume they can still travel if they don't know that you really shouldn't travel until you finish your series, because you're going to be held to that. The other thing I'll mention from this slide is we're also relying on cold chain processes to get us there, with the assumption that there are cold chain experts out there, and there are. But the history of cold chain has been this idea that it's actually cheaper to respond to a cold chain break or issue versus building in overly redundant systems. Now, that makes sense in a efficient goal, but when we're talking about vaccines and life-saving and trying to make sure that its liquid gold doesn't go to waste, we may need more of a mitigation redundant strategy versus a cost efficiency strategy. And so that's a complete paradigm shift within the cold chain mindset from what I've seen. And it's just something that people have to be aware of and not take for granted.
Yeah, the other point I'll make quickly is in the Warp Speed strategy document. They state around monitoring that Operation Warp Speed will construct and integrate an IT architecture, and points of administration will, with undeveloped infrastructure such as ad hoc mobile clinics, will be provided with free access to these web-based applications, allowing these administrative records to be aggregated, anonymized, and de-identified to protect personally identifiable private healthcare insurance. So essentially what they're saying is, we don't have a system. We'll build one, don't worry, and it'll be safe and it will monitor everything. My experience in healthcare is notorious for having really poor quality data, poor integration, lack of APIs between systems. Anyone who's worked with Epic or any of those systems knows what I'm talking about. So we have real concerns that the monitoring and the identification of the systems is going to be problematic here. Next slide, please. The next phase along the supply chain is source. And again, this refers to all of the raw materials that are going into these vaccine productions. So there are already, I think Pfizer has manufactured, 20 million doses, which are being deployed. But there are severe bottlenecks, not just with the Pfizer vaccine, but with Moderna and all of the others as well. And these include, really a lack of critical materials. So we've heard challenges with the vials themselves, even the rubber stoppers, believe it or not, that are used in some of the vials, and then the administration of the personnel. Do we have personnel that are healthy enough, that are being vaccinated, that can administer these vaccines? And believe it or not, there's been a shortage of rubber gloves. So a lot of the kits that are being distributed by McKesson along with the vaccines contain, like a mask and some other things. They don't have gloves. They can't get any gloves. So it's recommended that they wear nitrile gloves when administering the vaccine. So there are some real challenges here in terms of just supply alternatives. People saying, well, can't we find alternative, suppliers? Well, you have to get FDA permissions, and that can take months in some cases. And, if we do have shortages of things like natural rubber, can we get substitutes? Can they be approved? These are all real concerns, again, for components that are upstream in the supply chain. And we've been doing a lot of work on the testing supply kits. And as I've indicated in a couple of my blogs, sometimes it's just crazy stuff that runs out. Like they had a shortage of these plastic, pieces that were being used in the Hamilton testing machines, the transport kits that are used to transport the specimens. Like, you need all this stuff to be able to administer the vaccine, to be able to produce the vaccine. And if you don't have it, then, as we said in our earlier slide, you're disrupted, you're shut down, and it comes to a grinding halt. Any thoughts, Dan?
Yeah, I think the big one here that, I mean, and obviously I've seen the same information on natural rubber, Rob, which is very concerning because there's more than just COVID impacting that. There's environmental weather concerns that are impacting the sources for that. And that's other things too, is as we look at supply chains right now and disruptions, let's don't forget that like COVID-19 is overwhelmingly not the major disruptor to like day in and day out to other supply chains. These supply chain risks have always existed. It's just now more important than ever because of what it's doing to us. So things like weather patterns, factory shutdowns, factory fires, like that type of monitoring is important at the source to know. And then again, hitting on that health of the key supply chain personnel. I think we just take service personnel in general for granted in this country, that they're just a part of there's this great value service at the very end, which is delivering the vaccine, and that's all that we should be focused on. When in reality, there's just thousands of people before that ever occurs that are necessary and very important, all the way down to people who are sanitizing the plants in which this stuff is happening, right? Like those personnel matter. If they're not there, they completely shut down. I have family members in South Carolina that work in plants where entire shifts of people cannot work because they don't have sanitation to do an operation. That'll exist in these same facilities. And so that has to be a focus area.
Thank you. Next slide, please. On the actual production front, we've seen that there are definitely is a limitation on the amount of the vaccine that can be produced. Certainly, there are advanced plans to produce the requirement. One of the biggest sort of potential bottlenecks is what they call fill finish capacity, which is actually the ability to take the vaccine, the liquid vaccine, and put it into a form and put it into a vial that can be distributed. And I think each vial has enough for 10 or 20 or 30 different injections. In addition, for the Pfizer vaccine, that has to be carried, that has to be stored at a freezer, which is at minus 94 degrees. So there's extremely limited capacity. Most freezers, are designed for like maybe minus 20 degrees. Most of them are not designated for that level of cold. That's like a cryo freezing type of cold. And not only that, but there again, you run into the skilled personnel, the people who work in these fill finish capacities, the people who work in these storage facilities, and do we have enough people that are safe, that want to go to work, that are vaccinated themselves to be able to do that. The risks again are shutdowns. If the equipment breaks down, again, routine kinds of things. If you overrun the equipment, it'll break down. Doesn't meet the regulatory requirements. If you have to bring on new pieces of equipment, they have to be validated. If the FDA comes in and sees that the manufacturing is not being done in a sterile manner, it'll shut you down. So these are all possible risks that we don't think about, but which potentially again could shut down the production process. Thoughts, Dan?
Yeah, so on this one, I think, and this is probably a theme that'll come up into delivery in other areas too, but as we talk about the cold chain, the freezer capacity piece of that is also realizing that those freezers that we need and the cold chain sustainment that we need for this vaccine all has its own supply chain, all has its own components. And if you look at, maybe in some of the more urban areas where there's a lot more resources, it may not be as much of a problem. But I know in like rural and geographically separated areas, when they're going to be using some of this stuff for delivery, when components break down, that supply chain being ready to make sure we don't have, massive delays and temperature excursions that can eliminate that can occur. Now, within the make side of the process, that can also happen at the plants themselves. They have to be ready, willing, and able to make sure that the supply chain that supports those limited freezer capacities that they already have are up and running and able to prohibit large, large amounts of this vaccine basically spoiling for lack of ability to respond to a mechanical issue.
Next, please. So Deliver, I think there's been an awful lot of press and media attention on delivery and cold chain. Cold chain again is the ability to ensure that the vaccine itself, when it's being transported, and there's a long path there. It's being transported from the manufacturing facility to a UPS or a FedEx distribution center. These distribution centers, they've invested in a lot of the cold chain capacity at these locations, and then they're put onto a truck, and they're typically stored in a box with dry ice, that transportation is again point to point, and it needs to be then, and then it typically will go to a state location, may go to a state hospital. In some cases, it's going to local hospitals. But again, the plan from where it goes from there, it's that really gets down to that last mile, which is really difficult to understand. How does it get, if you're in a major urban center and it's distributed to a hospital, chances are, the hospital, you can probably get a vaccine shot at that hospital, and they'll have something set up for that. If you're in a rural area that maybe doesn't have a local hospital or a very small hospital, that's where the tricky issues come up. How does it get from the location to these smaller cities? If you live in a small town, how is it going to get out to that town? How are you going to get people who are in different facilities that maybe don't have access to transportation and can't get to a location? The long-term care facilities, they have designed an approach where they're working with CVS and Walgreens. CVS and Walgreens are going out to these long-term care facilities and they're administering the vaccine to the residents in these locations. Are they also administering them to the people who work in these facilities? Hopefully, yes, because those are the people also who are again, subject to being exposed. So there hasn't been, in my mind, a lot of real planning at a micro level across these different providers and locations. Give you an example. Again, I spoke with my physician, and she asked a question. Well, if they give me enough to do 5 vaccinations today, and 5 patients make an appointment to come in and get a vaccination, and 2 of them don't show up, what do I do with that leftover vaccine? Because once you take the vaccine out of the cold chain, it has a 5-hour window, and then it starts to deteriorate. So there's some real concerns about that last mile and how to handle no-shows, how to handle the vaccine being out of that cold chain, and the potential damage to the product. What do you do with those vaccinations that are potentially damaged? The risk there is, rather than throwing them away, they end up in the hands of someone who's going to market them on the black market and divert them, or try to use the containers and refill them with material that's counterfeit. So those kinds of last mile kinds of issues are of real concern to us. Not to mention malfunctions along the way, vehicle failure, vehicle breaks down, there's a power outage at a location, and the freezers no longer work. These are all normal things that happen. And in this case, you're dealing with this liquid gold that potentially could go to waste. And again, we don't have enough vaccines to vaccinate that we need to in each case. Dan?
Yeah, I think you hit on something, Rob, that really touches through the entire process that we could have said earlier, but it's definitely highlighted here in the delivery side, which is this is a national security issue, first and foremost, like throughout the entire process, right? So the cold chain itself, if you don't believe that, you go look at the BBC reporting and the other reporting on what IBM found with people hacking into the cold chain and trying to actually figure out how it's going to work. And they're still trying to figure out if that has to do with people trying to steal IP or if it's more for nefarious purposes. But either way, like there's obviously, other than the good of the whole, stuff at work here right now, people trying to hack into these systems. It's extremely important with the cold chain that we realize, like with Pfizer, I think the plan right now is dry ice packing, and depending on the length of the route, that dry ice packing has to be reaccomplished, over the time. So each time you open these packages up and try to recool them, you're allowing for temperature excursions, which can potentially damage the vaccine inside. I think there's a limit of like 2 package repacks before it's like you can't recover. But I do know that like this high touch handling in extreme cold like this, when it's hard to maintain that temperature, is very risky. The other thing people haven't really talked about enough is there's actually a CDL trucker shortage right now. So they're estimating a trucker shortage on the in the range of what we saw in 2018, which is around 60,000 less truckers than we actually need to transport goods and goods around the states. And so they're estimating that we're in a similar position now because of all the other constraints, because so many things are being delivered now instead of people going out to brick and mortar to get what they need. So that's something we also have to think about is like, how do we, not only do we not have the specialized transport capacity in all cases, we may not actually even have the personnel to drive the deliveries to where they need to go. So we have to be concerned about that. And then again, with the equipment malfunctions, the way we monitor inside the cold chain, if we're monitoring an actual container versus monitoring at the pallet level, we can miss things and not know when we need to respond. And so that's something that's been shown before. And so we're hoping, I haven't seen the details on this, but hoping that they're going to monitor these deliveries at least at the pallet level, if not at the individual package level, to ensure that we know when there's a section of the vehicle that there might be an excursion within versus the entire container, basically on average being cool enough, if that makes sense.
Yeah, and just to emphasize that, people say, well, we have confidence in FedEx and UPS. Once they deliver to that last point, they're no longer responsible. At that point, the state or the locale takes over. And I've actually spoken with a number of the CPOs from most of the 50 states. And in each case, they've said that the communications have been very light in terms of how they're supposed to handle it. And each state has, again, been sort of told, well, you need to figure out on your own how you're going to handle this. So there hasn't been a lot of direction from Warp Speed to the states as to how to handle it. They sort of have to, they're kind of left on their own to figure it out. And obviously some states have more mature Department of Health and Human Services that have done this before. And know how to deal with it. Others less so. So there's definitely going to be some variation across the states.
And I would say also to Rob, not to forget, and it's in the COVID-19 playbook, but they note that we got to focus on the tribal communities as well and the reservations within America. But what we've seen with the work that you and I have done with Project N95 on just PPE delivery, which is also going to impact vaccine delivery, which is the complete lack or seemingly lack of large depot centers and capability to receive goods within these communities and then distribute. We're hearing that not most, but a lot of them don't have, simple things like forklifts, or abilities to receive containers like this. So, those things have to be vetted out, but those are the sorts of stories we're hearing from the field that are really concerning. After you read a really good sounding overarching strategy, when you get down to the grassroots, it's a little more concerning.
Great, thank you. Next slide. So what we've put together are some examples. We had a couple of our graduate students work with us to kind of identify, what does the public refrigerated warehouse map look like? And you can see that there's, a pretty good, and we basically got this from the Homeland Infrastructure Foundation, which is part of the Department of Homeland Security, and put together a couple of databases. And you can see here that, major urban centers, especially the Northeast, Midwest, are in pretty good shape. But then you have this huge gap in the center of the country, the Dakotas, Montana, Wyoming, New Mexico, parts of, West Texas, where there just isn't a lot of cold storage capacities, just isn't there. And so there's real concerns is how do we how do we create, solutions to be able to get out to these locations? Remember, with the vaccine, we need to get 70%, 60 to 70% of the country vaccinated. So that it means everybody. So we can't leave out some of these rural communities. They're in fact, we've seen COVID spreading like crazy right now in places like Montana and Wyoming and the Dakotas. They've been seeing real surges. Other places like Western North Carolina and Eastern Tennessee, again, not a lot of West Virginia, just not a lot of cold storage in these locations. How are we going to get the vaccine out to these people? Next slide. So again, this is another view. We've created this mapping, and we're going to hopefully make it available. But you can actually start to see, within these locations, how much of this is actually validated freezer space. And our initial investigations have shown that most of this cold storage space is, as we said earlier, kind of cold storage down to the minus 20 degrees or so. Very little of it is down to the minus 80 or below. So this creates a real gap in terms of the capacity and our ability to distribute across the country. When you start to look at developing countries in Africa, parts of Central America, parts of South America, I suspect these gaps would be even greater. So from a global perspective, I know the Gates Foundation has been working on plans to how to get access to these vaccines. And these countries are in an even worse situation because not only can they not afford to buy the vaccine, but they don't have the facilities to distribute it. So there's real concerns on a global scale as to how this is going to be distributed around the world. And with something like, the vaccine, it's as we know, in a globalized world now, this vaccine spread all over the world. It originated in China, but it spread across the world quickly. So we can't just, immunize the US and say, well, we don't care about everybody else. It really is a global issue, and we're all in this together.
Yeah, I'd say too, Rob, just the value of mapping something like this, again, because most of these facilities don't have the ultra cold needed for Pfizer. But as we move forward with other vaccines, there'll be potential options. But the ability to visualize the locations as well as the clustering of how these occur is really important for state and local planners because, for instance, if you're sitting in Eastern Oregon right now, you may think you don't have options, but you can clearly see that there are options in Western Idaho, right? So then you can have interstate collaboration, right? Where this becomes a visual tool to help people make those sorts of conversations happen and discuss solutions because, pandemics are very much like environmental issues. You can't just say, well, it crossed the border, so it doesn't impact us, right? Like everything has a bleed over effect. And so we should be able to leverage the full capacity of the states to help this out.
Next slide, please. And again, these are some more clusters that we created. You could kind of see, in terms of the volume, and even again within some of these regions, there may be some bottlenecks. So, next slide. And we'll jump to the next one as well. Okay, this is another view. Thank you. The last piece that we're going to get to, and by the way, if people have questions or comments or thoughts, please feel free to use the chat feature, and we'll be opening it up to questions in a little bit. The last part of it, and I think this is kind of the most ludicrous, is how do we sell the vaccine to people? And you may not think of having to sell a vaccine, but that's exactly what we're having to do. In fact, one of our faculty members, Stacy Wood, has been working on a paper for the New England Journal of Medicine that's looking at how to do just that, how to work with DHS at a national level and be able to convince people that they should be taking the vaccine. And there's real concerns here. There's some of the early statistics show that as much as 60% of the population don't think they want to take the vaccine. And when you start to look at, for instance, some of the minority and diverse communities, it's as low as 10% say they want to get the vaccine. So there's a lot of misinformation floating out there. There's a lot of sort of mistrust of the government, even within North Carolina. 60% of people say they don't want the vaccine, and they had Roy Cooper on the news saying, we really have to build, spokespeople in our places of worship, in our local communities, getting people and the influencers in these communities and being able to sell to them the idea that, the vaccine is not only going to, it's not only good for the community, it's good for our cities, our states, our countries, but it's also good for you as an individual. And so there's a real need to be able to sell the vaccine in this case. The last piece of it is also around the return and reverse logistics in the supply chain. And the concern here is, there's going to be a huge volume of healthcare waste being generated by this, these used needles, and it's not clear how are we going to, handle all of this waste? How are we going to dispose of it? How are we going to return it safely, without it getting into the wrong hands? And again, the idea is can we do this in a safe manner? Can we do it in a way that will avoid, breakdowns in the supply chain or the disposition of these materials in an inappropriate way that could even, make the situation worse? And again, the whole issue of digitization comes up again. How do we ensure that we're capturing and monitoring who gets vaccinated, that they get, notified in a timely manner when to come back? I think the Pfizer vaccine, it's 28 days before they have to come back. The Moderna is 21. And how do we make sure that individuals are being monitored and are getting that second vaccine? A lot of people may say, well, I got the first one, that's all I need, I'm not going back for the second one, right? How do you educate people to make sure that they understand, no, you really need to go back for the second dose, or you run the risk of getting COVID as well. I think finally there's also a role for the antibody tests with the vaccinations. The antibody tests really haven't been used very much during the testing phase of what's going on in the country. But I think the use of antibody tests could be really important to make sure that people, in fact, are developing these antibodies and that they are truly immune to the virus. Stan?
Yeah, I think you hit on a lot there, Rob. One is just the track and tracing in general, right? The idea that when you talk about disposition and we get back to a national security situation, if the containers and everything are not properly disposed of and the wrong people get a hold of it, there's huge opportunity for counterfeiting and reselling on the black market, and a lot of things that could be really dangerous for the population. In terms of tracking the individuals and their vaccines, as well as these packages to make sure they're going, we do need to start thinking about more modern types of distributed ledger technology. So a lot of people have talked about blockchain technology and other forms of DLT. I think that's really necessary to make sure that we sort of have this sort of, instead of it just being one central location of data for a record that can be tampered with, it's actually distributed, and it's actually, more robust, and it's sort of, each step along the way when there's something that's scanned, it's actually captured for posterity. Now, this is an area where we're going to need really smart healthcare personnel, legal minds, and technical data experts in that space, because they're going to have to balance this idea of being able to have full transparency into the chain of this vaccine without, breaking any HIPAA rules or getting into people's privacy and things that they may be concerned with. People are really concerned in this country with the idea of being tracked by the government. We have a long history of that concern. And so we have to figure out that goes to the messaging. How do we message that, by allowing, through maybe like a personalized application that uses DLT scanning, or something like that, or tracking, how do we communicate that's the safest bet for the whole country and for yourself without, you're not giving up your liberties, you're not giving out your privacy, And so that's a really hairy area to walk with, but it's something that we've got to do because, as you say, with disposition of this really critical material, as well as tracking second dosage, I think it's a mandatory thing that we're going to have to really work through. And you can't just chuck it to the states and the tribes and the territories and say, you guys figure this out in your micro plan. That's going to have to be more of a whole of government approach, I think, to how we help these people all tell a similar story.
Thanks, Dan. Next slide. So this is another model that developed by Stacy Wood that talks about how do you not only increase stay-at-home compliance, but also how do you get people to think about how to convince them to take the vaccine. So this is an approach that's used in marketing called customer segmentation, and it basically involves really not coming out with a single message. And unfortunately, the government, has done that. They said, well, we can just come out with a single broad message and deal with, and convince everybody that they should take it. No, that doesn't work. What you really need to do from a marketing perspective, and Dan's a marketer, I'm sure he'll understand this, is you need to understand sort of the psychographics, which is, what are the attitudes, the interests, and the motivation for each, that drives behavior, that drives decision making within each of these segments, and how can we do this quickly, to identify, specific segments and what that could be. So it could be, if you're marketing to a North Carolina high school student, you're going to do it through Instagram. If you're doing it to, say, an older woman who goes to church, maybe it's the pastor of the largest church in her town. So understanding these influencers and getting them to appeal to people will be important. And that implies also to, making them sure that they understand how and why to social distance, as well as to get the vaccine, while they're getting it. So these are, some really interesting ways to think about how to communicate and how to market the vaccine and social distancing to people in the community.
Yeah, I think, Rob, the sad thing right now is that in a lot of spaces, and you brought up the governor in North Carolina, and I think about just the huge, just political divergence there in that state, because having lived there and being from the Carolinas, depending on who's in the administration, it's just a purple state, and there's just so many different camps there. And sadly, in something that should just be a scientific exercise, the deference for the disease is turned into a political concession, right? And it's almost like if you believe too much in it and follow too much of the rules, and you fall into this camp, and if you buck against them, you now fall into this camp, and that's somehow the flag you carry. And I think that's really risky. And it gets into the segmentation of psychographics and how do we get the right messaging to people to make sure they understand how to help themselves. One thing we haven't talked about in this webinar so far, that I'm actually experiencing right now as a person who has COVID with my family, is we're coming to the tail end of it, and we're starting to see those effects of what they call long COVID. And you're starting to see more and more long COVID symptoms coming up, and people having to deal with long COVID issues. That's going to have another strain on the same healthcare force that we need to get this out. So anything we can do to get people to really understand this is a real issue, it needs real deference. You have to, and to build trust is vital. So as much as we want to say this is a nuts and bolts supply chain issue, it's heavily a marketing issue as well.
Yeah, and I think the after effects include everything from hives, from fatigue, brain fog. So there's some really scary after effects that are becoming apparent from this virus. Next, please. So to kind of wrap it up, I think hopefully we haven't scared everyone, and they're absolutely terrified at this point. But we do believe that there's going to be some bumps in the road going forward. So I guess the issue is, I think one of the important things in any supply chain plan is awareness. Be aware of the possible things that could go wrong. And so, if you're working in an organization, you need to maybe look at some of these risks that we've identified here, and potentially, think through them. How are we going to deal with those? We think there's some good material out there for reading, and we can make those available on the website. And in terms of the federal plan and what's been developed, but also at a state level. I think at a state level and a local or city level or a county level, go to their websites and understand what's being done at a local level. Again, awareness is really important. I think every state and every county is likely going to have, something a little bit different. Might be, one of three flavors, but it might be some variation there as well. And I think finally, the last mile issue is one that's really concerning, and we would urge, policymakers at a state and local level to start thinking about these logistics issues and how to deal with these high touch, complex handling procedures. The picture that we have on the right is an organization called Micotech, and what you're looking at there is a portable cryo container. So it's a container that's able to refrigerate vaccines at that negative 80 level. And this is a company that's emerging. And Dan, you spoke with them. I don't believe that they've actually had a finished product yet, but they're in the early stages of hoping to deploy that container freezer. So.
Yeah, sorry, Rob. I had to cut the video off. I've got I've got an alarm going off in my house right now. Apologize, but yeah. So Micotech right now is a cryogenics firm, mainly out of Germany, but they do have a U.S. subsidiary out of Pendleton, South Carolina. They have the only thing that I've found so far that's a transportable, fully contained, designed for ultra deep freeze and for containers. But they're mainly a cryogenics company. So talking to their U.S. CEO, the main issue they have is they have the engineering, they have the IP, and they have the cryogenic parts and components to support this build, but they don't actually manufacture containers themselves. So this gets at the larger supply chain issues of like, how do we actually connect supply chains, like underneath the supply chain, right? So it's like, we're thinking about the healthcare supply chain and how to get vaccines to area X, but realize each component, especially critical components like this, have their own supply chain that we also have to consider. So how do we manufacture things like this? Because when you talk to state, local, and tribal, which is actually my number one concern, because it seems that federal is doing enough to take care of what they're considering their responsibility. But once it dumps down to the micro plan level, as we've discussed, what are those solutions going to be that help the Dakotas, that help the Montanas, the New Mexicos? And these are the things, but these things, just like we saw with 95s and ventilators, they don't get produced overnight. They take time to construct and to scale. Each one of these containers, I think, holds 1 million doses, which is hugely helpful, and it can keep them, for the full time within deep freeze that you need until you need to pull them out. And so I think it's a really novel solution, but it's going to take some investment, and something we need to consider.
Thanks, Dan. So I'd like to open it up to any questions. I don't see any in the chat box, but we're happy to address those. The last couple of points, I think understanding the cold chain facility capacity is going to be important. The idea of exploring some of these one-stop transportation options, especially for handling, around these temperature-controlled environments in rural areas. And, I think, the best way to also validate a supply chain is to trial it, right? So temperature excursions, looking at how to monitor those, looking at how to, how to run some tests, with these containers at the pallet level, the container level. And I think what we've really identified is the lack of digital solutions. And that's a shame, because I think there's some really good digital solutions out there. We know of one that a company called Rimini that did the testing at Clemson University, and they actually had a badge, that would show up on your phone that showed whether you've been tested. If you tested negative, you get a green badge. If you tested positive and need to get a PCR, it's yellow. And if you haven't been tested, you get a red. So there's ways to to use mobile technology and to combine it with informatics to be able to better monitor who's getting the vaccine, who hasn't, when they're due for it, any after effects. We think there's a tremendous potential there, and we haven't seen. I know there's maybe some of this stuff is in the works, but it really hasn't been deployed yet at a level that I've seen that needs to be done. Any questions from anyone at this point? No, not too many. So, well, we want to thank you for coming today, and I think this has been a useful session. And any final comments, Dan, you'd like to make?
Yeah, I mean, one of the things I wanted to bring up is that I'm, me personally, I'm not wanting to demonstrate that I feel that we've cracked the code on anything. We've basically cracked the code on concerns, right? Which is, Rob has a ton of experience in history in supply chain and medical supply chain. I have most of my experience in government acquisition and enterprise sourcing for the federal government. So most of what we've done over the past, 6 to 8 months has really been a huge lift of a coalition of the willing, which is just people who are willing to take the skills they have and apply it to solving these difficult solutions. One thing that we learned early on with the Strategic National Stockpile is there's sort of this overriding belief that the federal government or there's this group of experts in a war room somewhere who are just solving all these problems. And the reality is if you're sitting around going, I haven't really seen the details of the response to this and how it's going to work, that may be because they don't exist, right? And so that may mean that you need to start putting your heads together. And, I think there's an article in the Atlantic that just came out about like the massive tidal shift in the focus of scientists of every discipline since COVID-19 has occurred. How everyone has basically dropped whatever they were researching in the science space and moved to this, even if they're not a medical professional. And I've definitely seen that, and I see the value in it. And so I hope you guys see what we're trying to offer is from our perspectives and our experiences and our expertise, and that it can open up a conversation to make real difference happen.
Yeah, and I see there's one question. Someone asked a question about transportation allocation. That's an excellent question because I think there is going to be a lot of allocation going on. At the moment, we work with an organization called FreightWaves, and they track the volume of refusals, which is basically drivers refusing to pick up a load. Those are up significantly. They're up to 15, 20%. And the freight rates are going through the roof right now for container load or even less than container load. So we think there's going to be a lot of allocation going on as well. So that's an important issue. A second question: is there any discussion of using the already available Slow COVID NC app with the vaccine process here? I have that app. It works great. It allows you to look at your social network and to see if there's anyone near you that has it. To my mind, no one has really talked about how that might be used. For in conjunction with the vaccine as well. One last question we can take: this holiday season, vaccine distribution companies using 3PL for their logistics. Again, I think the 3PL companies are going to be stretched. Combining the existing volume that they have, which usually is peak around this time, combined with COVID and the Amazon, et cetera, sales that are almost all online. All my Christmas shopping has been online this year. It's grown to 100%, and I think for most families it is as well. And layer on top of that the vaccine distribution. They're going to be putting in a lot of overtime, and I think we're going to see rates going up there as well.
Yeah, and I think that's a key thing too, Rob, is just think about all of those delivery people that are not at the front of the line for a vaccine, right? And just heavily strained right now on everything being, as you said, going to delivery. I think, supply chain and logistics is getting a lot more spotlight than I think it ever has, and it probably ever will, because this is a perfect storm right now.
Okay, well, thank you all very much. And again, this will be recorded. If you if you want to see it again, or or want to show it to someone else in your circle, there's no cost for doing that. And we want to thank you all for coming today. And feel free to contact us with any further questions. And thank you for your time today, Dan. And I hope you and your family are recovering from COVID. You got it last week, so.
Yeah, it's an interesting experience. I'll have to talk to you about it, but I think long-term COVID is a real thing, and we're going to have to think about it. So, yeah, one more thing. Thanks, everybody.
Thank you.